When a patient requires more oxygen than a simple mask can provide, but isn't yet in full respiratory failure, we need a precise step-up. You might notice their oxygen saturation dropping despite standard therapy, or they are showing signs of moderate respiratory distress. This is the critical window where a partial rebreather mask becomes the bridge to stabilization.
The magic happens in the reservoir bag, where the first third of exhaled air, rich in oxygen, is captured and mixed with fresh flow. Unlike a non-rebreather, there are no one-way valves between the mask and the bag, allowing the patient to rebreathe some of their own air. This design allows for a flow rate of 6 to 10 liters per minute, providing an FiO2 of 50 to 70.
As a nurse, your priority is ensuring that the reservoir bag remains inflated at least 1/3 to 1/2 full during inspiration. If the bag collapses, the flow rate is too low, and the patient won't receive the intended oxygen concentration. Monitor the flow strictly between 6 and 10 liters to maintain that 50 to 70% FiO2 and ensure patient safety.